Hi, I'm Dr. Jonathan Hammersley. I'm a faculty member at Western Illinois University in the psychology department. This is my 7th year teaching and doing research in the psychology department. My background is as a clinical psychologist. I did my PhD at Southern Illinois University in Carbondale in clinical psychology, and I run the clinical and addiction research lab here at Western Illinois. Some of my interests include studying addictive behaviors. I study clinical topics, mental health symptoms, mental health treatment outcomes, attention bias and how it might relate to mental disorders. I'm currently working with about 7 students this semester in my lab. We have several studies that we're either doing or we're getting ready to start this academic year. We just finished an on-campus study where we're studying smoking and caffeine use behaviors and how those types of behaviors relate to different individual differences, motives. We collected some saliva samples that we're currently trying to genotype. We've been collaborating with the Department of Biology. Dr. Mike Romano, who recently retired, is still helping out a bit. In my study on caffeine use and cigarette use, we had all of our participants basically spit in a cup, and we have frozen all of their saliva samples. Currently, one of the biology faculty and one of my graduate students are helping to analyze that saliva data. It's all upstairs in the genetics lab. It's frozen. They're running what are called PCRs, polymerase chain reactions, to extract DNA, and then we're examining different alleles that relate to dopamine receptor functioning. Those different alleles for dopamine receptors, DRD2 receptors, are shown to relate especially to addictive behaviors like smoking. They're shown to relate to personality factors like impulsivity and thrill-seeking behaviors, which are similar to drug use. Those individuals tend to use drugs and use a lot more caffeine, use more nicotine, drugs like that. So we're excited to see how those relate to different personality factors and drug use factors. We're currently collaborating with the lab at the University of Minnesota, where we're starting to develop some images on video gaming. The new DSM-5 that just came out a few years ago includes as a condition for further study an internet gaming disorder. So we're trying to be one of the first labs to come up with a standardized image set to look at video game and how that might elicit urges in individuals who are prone to video game addiction or internet gaming disorder. And we're planning to use some of those images to look at attention bias and those types of things. We're also currently collaborating with Dr. Kurt Dunkel in his lab. We're doing a study where we're analyzing data from the ABC Abecedarian project in North Carolina, where they took infants and started a group of infants in an educational intervention and followed them long term through the age of 21. And we're currently looking at life history and how that moderates things like improvements in mental health, improvements in IQ scores for those groups of participants at the age of 21. I'm working with a new graduate student we're currently looking at attention bias. We're reanalyzing a study that I did where we displayed animate and inanimate images, and we're measuring attention bias in depression and anxiety and how that relates to just the differential processing of animate versus inanimate imagery. And finally, I'm interested in treatment and treatment outcomes, what works, what doesn't work. We've been working with the Center for Collegiate Mental Health at Penn State, and we're helping them analyze some data just on college counseling clients and what types of treatments work, or about 10 to 15% of clients that go into counseling actually get worse. They don't benefit from counseling. Their symptoms get worse. And one of the ideas that we would like to explore is what predicts those worse outcomes. So I'm collaborating on a project with Dr. Christy Keefe and her lab. We're specifically examining first-generation college students and what their presenting problems look like and what their treatment outcomes look like in comparison to other types of college students. So those are just a few of the projects that we've been doing last year and that we're continuing this academic year.